Hi, my name is Dr. Rana Javadaskar, and for last 30 years, I'm a public health professional. And for last 20 years, my main job is to identify, detect outbreaks, and then control them, including epidemics and pandemic. So let's talk about hantavirus because pretty much every newspaper and television station is talking about it, and people are worried about it. And there is the whole talk of conspiracy, and all of those kind of things. But let's talk from a clear message or clear information which others can easily understand. So that's the whole purpose of this presentation. We're going to talk about hantavirus briefly, also about this outbreak which has happened in that cruise ship. So first, what is hantavirus? Hantavirus is a group of RNA viruses carried by rodents, and is spread through contact with rodents' droppings, urine, saliva, etc. It has two main variants, if you could call them. One is America's, what we find in mostly South America, which attacks to the lungs, and it's more fatal. Like the fatality rate is 40%. The other one, which is found in normally Asia or Africa, it affects kidney, and its fatality rate is lesser than the one we had in Americas. So the Andes virus, out of all the hantaviruses, the Andes virus is the only virus which can spread from human to human. All other hantaviruses normally need a direct animal contact, and even if there is a human to human, it's very limited. But that's the only virus, the Andes virus, which can transmit to human. It's still difficult, but that's the one we are facing in that cruise ship. It has fatality rate of 40%, as I said. First time we identified it in 1996, and yes, the only virus with a human-to-human transmission. If we look at the timeline, on April 1st, ship departs in South America, and on April 6th, the first symptom was uh, identified or complaint. April 24th, the ship docks to the St. Helena, another island, and then on May 2nd, WHO notified that virus is confirmed. So if you look at the timeline, it's already 1 month. In that 1 month, other people got exposed to the patients and started getting infected. Arrives on May 10, and until May 12, there have been 11 cases and 3 deaths. So the cruise ship has 88 passengers, 59 crew, and with 23 nationalities. And as I said, 11 total cases, 9 confirmed, 2 probable, and 3 deaths. So the challenge is now, and what's now happening is that the different countries are taking their own nationals or citizens from that cruise ship and taking them to their quarantine facilities in their home countries. Just like for the US citizens, they have been brought back to and kept in quarantine centers in Atlanta and also Omaha. So the hantavirus, as I said, spreads through rodent to human, and human to human is only Andes, which is very, again, limited. So its signs and symptoms and how it progress. Phase 1 is early. It lasts 1 to 5 days, and it has basic non-specific symptoms like fevers, chills, severe muscle aches, headache, nausea. But in the phase 2, which is more critical, severe breathing difficulties, rapid, pneumonia, and other complications happens. In the one with the what happens which is more prevalent in Africa and Asia, their symptoms are more focused on kidney problems. Can be fatal with 24 to 48 hours, and we have already discussed this. The fatality rate is very high. So, how to protect ourselves from this hantavirus infections? So, number one, our house should be clean and clear of rodents. So the entry points we need to seal. And if you noticed anything bigger than a pencil, uh, any hole bigger than pencil near foundations or your walls, just seal them because they could be an entry point of the rodents into your house. Keep things clean. Keep food already locked somewhere, covered, so the rodents cannot take a bite out of it. Waste should be properly disposed and should be put away from your house so that it does not attract rodents and other things. If you still have those rodents, get a trap. If you can't do it, uh, hire a firm which can basically control your rodent problem. Having a rodent in your house or around your house is not a good thing. It's a very big health hazard. And there are safe cleaning procedures. Just in before, sometimes we see the rodent dropping and our first intention is to start cleaning, either vacuuming it or either pushing it using some broom or something. This is wrong. You should not be doing this. First, make sure there is a good ventilation, and if it's a room, open the windows. So why we do it? Because the it dissipate the virus, and the quantity of virus becomes less in the air, and so you can it will be safer for you. Then wear protective gear, masks, and the many people wear surgical masks or cloth masks. They are not beneficial in those situations. In COVID, we were using KN95 masks, KN95, so use those. They are much better. Make sure they cover your nose and mouth completely, and then wet add some disinfectant and wet your whatever the waste things are there. And I have given the just use 1 part of bleach, 10 parts of water, sprinkle it, kept it for 5 minutes. And before then wiping, don't use the broom that it will spread. Just use a napkin or something, a paper towel, and just wearing your gloves and everything, wearing your mask, and it's already wet and you have used bleach on it, just then dispose of, and keep the surfaces clean. So just giving a broad overview, there is no vaccine available at this time, no definite, no specific treatment available, but people are working on it. WHO, CDC, and other international organizations are also working on it to control this outbreak. The rising global cases is issue of concern. Now 35 countries have reported one way or another um, um, a hantavirus case. So in the last, you need to remember this thing. Risk to general public remain extremely low. If you are infected and if you are exposed, your personal risk is very high, much higher than COVID. But on a general population scale, it's a very low risk. I don't expect it to be another pandemic anytime soon. With this, I thank you for your time and hope to see you later.